does the presence of medication or treatments like that impact things like insurance coverage of the surgery? How-
It, it, if someone, it does not. If medications are covered, they're covered. The risk is that if somebody is treated for obesity before, and if on the day of surgery they fall below the BMI threshold for surgery, then that can impact whether or not they
Mm,
can have surgery.
gotcha. So there's that talk specifically. Are there any aspects of that talk that you think are particularly interesting or stand out that we haven't covered?
The bariatric
Yeah,
talk, that's pretty much it.
gotcha. So what was the second talk or presentation that you were a part of?
Okay. Within the last year, a group of us put together some evidence-informed recommendations for nutrition for patients who are taking obesity medications. There has been a dramatic increase in popularity for using obesity medications just because now we have effective agents that also have benefits beyond weight reduction for cardiometabolic health outcomes as well. I think when you look at studies that model out what happens from a nutrition perspective when people take these medications with the potent appetite suppression that we see with the newer agents such as semaglutide and tirzepatide, intake decreases by about 1,000 calories per day. Unfortunately, the quality of the average person's diet in our country is not really where it should be. It doesn't really align with recommendations for quality. And so if you have somebody who's eating a relatively low quality diet, you then decrease their intake by more than 1,000 calories per day, you increase their risk for malnutrition. And when you look at what's in the news these days about what concerns do people have with these therapies, that includes loss of lean mass, malnutrition, perhaps bone issues as well. So you can imagine if you're creating malnutrition by using these agents, then we may not be optimizing outcomes.
Mm. Yeah, that loss of bone mass is something that I've only heard of kind of in doctor circles. How does that manifest in patients' lives? Like, how are we seeing kind of this potential loss of bone mass like show up in people's lives? Is this kind of more of a long-term thing, or are these things that people typically see sooner rather than later?
Well, many of the people who start and take obesity medications are women in the peri and postmenopausal period, where women are also at the greatest risk for bone density loss
Mm,
because of reductions in estrogen.
mm,
And so we already have a population who may be experiencing loss in bone density. And then if you add on additional medications, that could potentially impact that too.
mm,
And so I think what we need to do is make sure we have an idea or framework of who at risk individuals could be so that we can do appropriate screening to make sure that we're not getting into an area of concern with regards to bone density for an individual who may have risk factors, and to make sure that we are trying to strive for nutritional quality and adequate, recommended intakes of things like calcium, vitamin D, and regular weight-bearing physical activity.
mm.